An amiable welcome to everyone. This is your Allied Lecdem channel to enhance your understanding. Today we are going to see about complications of hemodialysis. Hypotension. The most common complication in hemodialysis is hypotension. It is defined as low blood pressure. It decreased systolic blood pressure by greater than 20 to 30 mmHg from pre-dialysis pressure, and the systolic blood pressure is increased 100 mmHg. Intradialytic hypotension is defined as a decrease in systolic blood pressure that is greater than or equal to 20 mmHg, or decrease in mean arterial pressure that is greater than or equal to 10 mmHg associated with symptoms. The complications are cardiac arrhythmias, coronary or cerebral ischemic events, and the long-term side effects are volume overload due to suboptimal ultrafiltration, LVH, and intradialytic hypertension. Next, the causes of hypotension. Common causes: removing too much weight, taking antihypertensive pills before dialysis, heart disease, and septicemia. Less common causes are anemia, low weight gain or dehydration, anaphylaxis, air embolism, eating or drinking during dialysis, dialyzer reaction. Signs and symptoms of hypotension: gradual or sudden decrease in BP, cold, nausea, vomiting, muscle cramps, chest pain, yawning, pallor, decreasing mental status to loss of consciousness, seizure. Treatment of hypotension. Treat the symptoms. Pay attention to how the patient feels. NS bolus. Place patient in Tendelberg position. Use sodium modeling. Strategy to prevent hypotension during dialysis. Use a dialysis machine with an ultrafiltration controller. Counsel a patient to limit salt intake, which will result a lower intradialytic weight gain. Reassess the patient diet weight. Use a dialysis solution with a time average concentration of sodium 140 to 150 mm as tolerated. Give daily dose of antihypertensive medication after, not before dialysis. Use bicarb containing dialysis solution. Use dialysis solution temperature of 35 to 5 Armstrong degrees Celsius with adjustment downward as needed and tolerated. Ensure a pre-dialysis hemoglobin level. Do not give food or glucose orally during dialysis to hypotension-prone patients. Consider use of blood volume monitor. Consider a 6-week trial of sertraline. Extend the length of dialysis by 30 minutes. Muscle cramps. Painful muscle spasms. It causes associated with removal of large amount of fluid. Hypotension. Changes in electrolytes. Inaccurate fluid removal goal. Signs and symptoms of muscle cramps can occur anytime in dialysis, especially middle to end of treatment. Muscle cramping of extremities that can often be seen. Hypotension. Treatment of muscle cramps. Treat these symptoms like normal saline bolus, reduce UFR, massage or apply opposing force, assess diet weight. Disequilibrium syndrome. Defined as a set of systemic and neurologic symptoms that include nausea, vomiting, headache, restlessness, hypertension, slurred speech, seizure, and coma. Cause of disequilibrium syndrome. Causes: slower transfer of urea from the brain tissue to the blood, rapid changes in serum electrolytes, especially in new patients. Treatment of disequilibrium syndrome. The treatment are: monitor new patients carefully for hypotension, decrease blood flow rate, treat N by V and headache per protocol, be alert for restlessness, speech or mental changes. Nausea and vomiting. Causes: hypotension, uremia, disequilibrium syndrome. Treat the symptoms. Hypotension. Give sodium bolus. Determine relationship to dialysis. Headache. Causes: hypertension, inaccurate dry weight with too much fluid removal, rapid fluid or electrolyte shift, disequilibrium syndrome. nervous tension, caffeine withdrawal. And symptoms are pain in the head or facial area, hypotension, nausea, vomiting. And the treatment for headache are unit policy for analysis, hypertension, BP assessment, hypotension, sodium bolus. Chest pain, angina. Chest pain caused from ischemia resolved by nitroglycerin. Myocardial infarction, it is also chest pain caused from ischemia that result in tissue death not resolved by nitroglycerin. Causes of chest pain: ischemia to heart muscle, anemia, hypotension from fluid depletion, hypovolemia, anxiety, blood flow rate increased too rapidly on patient with known cardiac disease. Angina and myocardial infarction symptoms. The angina symptoms are pressure, pain localized or may radiate to neck, jaw, shoulders, arms, may come and go, choking or strangling sensation, apprehension, squeezing or crushing or pressure sensation, and duration is 1 to 2 minutes, nausea, pallor, cool, clammy skin. For myocardial infarction, the symptoms are pressure, pain localized or may radiate to neck, jaw, shoulders, arms, may come and go, apprehension, choking or strangling sensation, squeezing or crushing or pressure sensation, nausea, pallor, cool, clammy skin, hypotension. The treatment are treat the symptoms like hypotension, angina pain with nitroglycerin, MI pain requires analgesia, anxiety or stress. Itching causes dry skin, secondary hyperparathyroidism, abnormal level of calcium, magnesium and phosphorus in tissue, allergies, uremia with elevated bun. The treatment are adequate dialysis to regulate electrolyte level, lotion or medication for dry skin or allergies. Chills and fever causes infection or septicemia, cold dialysate and pyrogenic reaction. Symptoms are infections like fever during dialysis, feeling cold with fever, redness, swelling, tenderness or drainage from access site, septicemia, respiratory, fever reaction due to presence of dead bacteria, endotoxins, and it is caused by contamination of bicarbonate containers or system, water system, machine, dialyzer or bloodline. And the symptoms for pyrogenic reaction are cold sensation upon treatment initiation, sudden shaking, chills, then temperature elevation. Note increased pulse before chills develop, hypotension, headache or muscle aches. And the treatment are remove from dialysis immediately, gather samples of dialysate or blood per company policy. Hypertension causes fluid overload, non-compliance with blood pressure medication, anxiety, renin overproduction. Symptoms are gradual or sudden rise in BP, headache, blood vision, nausea, vomiting, dizziness, seizure. Treatment are review of BP medications, assessment of target weight and fluid removal goal. And the technical